Good morning, everyone. Thank you for joining us for our Coalition Capacity webinar. And well over 100 people registered for the training today. So we are going to get started in just a couple minutes and wait for a few other people to filter in. Hello again, everyone, and thank you for attending our webinar today on trauma-informed family engagement. And this is in partnership with Prevention First, as well as the Coalition Capacity webinars that we provide for our member coalitions, as well as the general vicinity across the Tri-State Network. And I have the pleasure of introducing Alicia Longmire, that is our Manager of Community Action here at Prevention First. And I will pass it on to Alicia to get us started on the webinar today.
So good morning, and thank you all for spending an hour or planning to spend an hour with us today. I'm so excited to bring to you something that I have was a part of late last year, right as we went into a shutdown. There was an opportunity to learn more about trauma-informed care, but in the context of family engagement. I would like to share with you some of my history as a person, a part of the healthcare continuum and prevention field. I have some background in research, and part of my research a couple years ago, which led me into being involved in trauma-informed care, was related to addressing children who were more likely or high risk for drug abuse, use, and abuse later on in life. This all started as part of a research project that Children's Hospital, along with a coalition called People of Color Wellness Alliance, came together to address some issues in our community, specifically as African American urban communities, where a lot of resources were not always available. And because of that, there was an increase of multiple issues, including the health disparities, as we are now well aware of, especially here in the pandemic that we're surviving in. That research brought us to understand that our children and our families they may be using those substances and those things and community are not healthy as coping mechanisms because there was underlying issues related to trauma that was brought about and unresolved issues that are still there. And as they become adults, they are now passing that on to their children and not aware of the impact that is taking place with their psychological health and actually their overall well-being. So this opportunity came up, and I was really excited to take part of it because it was a partnership, as you see here, with right there at the bottom of almost all the departments of Ohio came together to bring about a training that could be facilitated online related to trauma-informed family engagement. As you see, Bold Beginnings is the early childhood initiative for the state of Ohio, and that group came together to create some kind of training that to take us beyond just understanding trauma, but how can we make our family engagement more trauma-informed as we interact with our families? So I just wanted to highlight that piece about my background and why this project you see here is a compilation of efforts related to those state agencies coming together, creating this presentation, and then allowing myself and others who were trained under that to bring this training to you. So it was actually created by Hopewell Health Center, and that was the funding developed and given by Ohio Department of Family Services through a grant called Birth to 5 grant. And we were given permission to deliver this to you, and I'm thankful that the individuals here on the slide, Misty Cole and Aaron Lucas, who trained me, were able to do this during the shutdown, and we did this all together as a 8-hour day of training. So we're bringing to you just a snippet of what we were able to engage in. So again, welcome to the Trauma-Informed Family Engagement. I'm so glad you're here, and I want to thank you for taking the journey with us today. As you understand, family engagement is vital to strong communities, and adopting a trauma-informed approach is vital to success of family engagement efforts. If I was in front of you, this would definitely be an interactive dialogue to discuss why you think family engagement is so important. But we will break that down as we go into the presentation. We want to work together to understand the best practices in trauma-informed strategies and how to develop an effective family engagement plan, which will be also given to you in a handout as we end the presentation. My moderator, Abby, will send that to you via email. So we can move on to the next slide. I want to thank those who did come together. As you see, these are the Hopewell Health Center's logos, as well as Bold Beginnings and the Trauma Informed Care Collaborative of the state of Ohio, which are broken up in regions. If you're not familiar with that, I can also send that information to you as well. And these are leaders in our community that has a background in trauma-informed care and interested in helping our communities be more trauma-informed as well. It's also brought to you by UMADAB, the Urban Minority Alcoholism and Drug Abuse Outreach Program, which is out of the Lucas County, that came together to help put the program together, but then also to facilitate those in urban communities to get trained as well. So this has been a great success, and here we are now, a year later, able to deliver this content. So we can move on to the next slide. As you see this, also, again, thank Prevention First. Thank you for those who are here on the call for Prevention First as an entity that is here doing the good work of delivering prevention, quality prevention, effective strategies around reducing the use of access to drugs and alcohol among our communities. And understanding that trauma you have to be aware of it, and understanding that it does impact how we deliver our prevention efforts in our community as well. So thank you to Prevention First. We can move to the next slide. So again, this will be normally where I will ask you to, if you have any questions, you can participate using the chat. We will try to respond. I think Abby is going to, if you raise your hand, she can have unmute you. But we're going to refrain from that. If you can just go ahead and type your comments in the box. We just don't want to unmute everybody, and we're not able to manage that. So let's move to the next slide.
And I'll also mention the chat feature is a little bit different on this platform. It's for attendees, it's a question feature. So you should be able to see that on the control panel. And then also on the control panel, you can see that option to raise your hand. So we'll have some options for input and questions throughout, and then also have a formal question and answer session at the end of the presentation.
Thank you. Okay, so thank you, Abby, for that. As part of what you signed up for, you will learn today how to define trauma-informed family engagement. We're going to identify some barriers of that and explore some of our own implicit biases, because we have to understand this is when we're serving our community, what we provide, it comes from us. The services comes from what you have inside of you, where you come from as well. So we come with, all of us have this, and we come with that, but understanding that it should not get in the way of how we service our community. And we just want to explore that. There is a simulation activity that we would kind of work through if there is an opportunity to do that, to kind of show you when we are raised in our own environments and when we are out in the community, within our own circles, we have our own biases, and to understand that so we can be better service providers is helpful, and actually will help you do better in getting your outcomes as well. So because the systems we're working with are only good as those who operate it. It is not the system itself that's so bad. Sometimes it's those who operate it that cannot get past some of their own issues to help others. And the third one that we identify is the strategies to develop a plan. And there is a worksheet again that you will get during the email as part of the handout. And we'll go over that as part of this session. We can go on to the next slide. The next slide here is just showing a little bit of why we have to explore and do self-reflection amongst us as we do provide services. There is a study, as you all are probably familiar with now, the adverse childhood experiences. And we'll talk about this later in the presentation, but here is opportunity to look at the prevalence that exists among the ACEs. That is just not talking about people who's dealing with trauma or current trauma or had trauma. This is throughout the country where we're seeing these ACEs so high that we know that it's impacting us on what our work and what we're doing, because this also includes me. This is not just a group of people who are considered sick or need services or getting services from a disability or getting the service from the Ohio Department of Health or Job and Family Services or getting Medicaid. These are people that are actually just like us, are providers who are getting the same or dealing with the same issues, such as the socioeconomic hardship, those who have understood or saw divorce and parent separation. If you look at the different pieces related to ACEs, it's all from your experience with your family. So if we understand that, especially that lives with someone who has alcohol or drug problem, our perspective of prevention that's a huge piece, because that we understand that piece is where you draw from when you're trying to deal with a problem. And if you have seen this in your family or part of your environment, how likely are you going to do the same or repeat the same behaviors? And that's what our process of, when we're in prevention, we're trying to decrease the likelihood of participation in these kind of adverse behaviors, because we know that it will not end well with your health. So that's just opportunity to take a look at this chart. Just take care of yourself. This is a part of our us learning about ACEs, is to take care of yourself and understand that you may have come from the same type of environment that we help others get out of, and understand that you're also impacted as well. So I just want to make a note of that. Let's move on to the next slide. So our first objective, we're going to define the trauma-informed family engagement. I'm hoping in the next slide you can see the video, because this video is just an example of what actually family engagement can look like. If you've all seen this, that's great. I want you to see it again, just to experience the family engagement. Hoping everybody can hear it.
Alicia, could you hear it on your end?
I could not. No. Mm-mm.
Okay,
But that's okay.
Let me try one more thing.
Okay.
Can you hear that?
No. Mm-mm.
Okay, let me just
But that's
go,
okay.
let me exit out and then I'll play it from my laptop. Can you hear that, Alicia?
No. But they may be able to hear it. So. But as you all watch this video, and if you can't hear it, I do apologize, but that's okay because we're in a world of virtual learning, so this can happen. I just want you all to know this is not, it's a really feel good video, and it's an opportunity to see a parent who is talking to a child. He doesn't have words yet to share. He's just mumbling, but the father is taking opportunity to engage with his child. This video actually went viral, and this guy now who is a comedian shared what he did with his son just to share with people how you have a conversation with a toddler. So he was able to do that. And what we like about this video is that you can engage at any moment of life with your child. And we're talking about just a toddler, not a full adult who can communicate well. We're talking about just a child who is listening to his father and responding, and that's kind of what we're happy to see. We always encourage our parents to engage with our kids at teenage level, or engage with your child at preteen. But what about this little baby where there's not much he can tell you, but this is an opportunity to see how he's reacting to that child's action. And the father is really teaching a crucial skill that acting is a part of the brain building interactions. I'm not sure if you are a part of any in your field that deal with 0 to 5-year-olds and those under the age of 18, but that is a big thing that starts as a child being that young. It starts that young in building the brain interactions. And the fact that both of them are enjoying it makes it even more enjoyable to watch. So like I said, if we were together, I would say if you want to, you could click a quick comment in the chat to see if you've seen this video before, you heard it, and thought you want to have a comment, you can put that in the chat as well. But that is just a wonderful way just to show how family engagement is possible even at this age. So then why is that even important? So we're going to move on to the next slide to get the definition of it so we can understand why it's important and how it's recognized as the foundation for success as we do our human services and education. This also is important for teachers as well. So if you all take a look at that definition, the family engagement, this refers to a system that allows inclusion of family as part of activities, as programs to help promote development. And that's really all this definition is really saying. So if we have opportunity to develop our systems that allow for this type of inclusion, then we want to say that we are engaging our families. Our organization sometimes, and from my background, I can relate very well to this, where we can say this is best for the family, but we have never went to engage in families or been part of the conversation with the family to make them know first that you're a partner, okay, and that we're providing service to you because we're serving you. And we want to make sure that this service to you is going to help your family grow and develop. So if there's anything that anybody want to share in the chat, what stands out to you in this definition? For me, if you want to put something in the chat really quick, you can. For me, in my own story, I want to say that, like I shared before, I was part of a coalition, and the coalition is still moving forward. But I believe that our weakest part was not really engaging as much as we could in the communities that we're in. Sometimes there's our own biases that I talked to you before about that kind of get in the way of allowing that communication to take place. There's not a conversation or this opportunity to engage because we're maybe afraid to pull that out of the community, pull it out of the person that we're dealing with. We may be afraid to address it. We may have bad interactions before. We may not have liked the community members that we're dealing with. All that goes into play when we're looking at how to engage a family. We got to remember that this part of being it's a strength-based interaction. We're trying to meet families where they are, not so much making things work for them. We want them to be part of making the system work for them. We want them to tell us what works for them, not the opposite. And I know from my own personal perspective that I was always a part of that. I could be part of that group until I learned about being trauma informed, that I cannot tell you what works for you. I want you to tell me. But because I was always the one in front of in the system and part of that system, I was driving the decisions, and sometimes you can get in the way. So we just want you to know that from this perspective, it's a part of including the family as members and partners of the decision-making process, so that we're creating and developing positive outcomes for our community. So I'll move on to the next slide. As far as the family engagement, this here is just showing you the different pieces of family engagement. And it's a part of, and what you can see at the bottom, how you can get to the positive goals-oriented relationships. It's also trying to include, as best as we can, the cultural and linguistic responsiveness. So with trauma-informed care, there are just these pieces that have to be a part of it, and they're meaningful as part of the family engagement. The foundation of parent engagement has to be positive, going-in relationships, which include the cultural and linguistic responsiveness, as well as inclusiveness. Now, for a program level, you got family that involves leadership. Okay, you may not always get that from a family because you may not understand who's the real leader in the family. But we have to identify that. We have to get to the source. We have to find out, as part of that family, we may have to develop the leader. We may have to understand that the child is the leader in the family and the parent is taking that lead. I've seen that before too. I'm not sure of your background, but that could be something where you're like, this parent isn't running the household, it's the child. So how do we develop the parent to be the leader and create leadership opportunities? This could be part of that, so that they become partners. We need programs that focus on that, and we need also commitment to continuous learning and quality improvement. The program environment that I've worked in help create strong families, and that's the goal, is to be strength-based. But most importantly is to be reflective. And as I said before, I believe the biggest piece that I could do better at was just to reflect on what I was doing. There was a big piece when you have grants and programs and projects. Your goal is to get it done. It's not always to be included, get the parent included. And you may have that as your first priority, but when things take a really long time to take place, it takes a long time for a parent to identify their needs. It can be a long process, and you may leave that on the floor. You may say, you know what, this is taking too long, I have to drive this. But that's where we lose our engagement piece. So the program foundations list examples of how we can be of continuous learning and quality improvement. The program impact, as it lists here, we're going to have a positive community interaction. We're going to have continuity, where you have an opportunity for that family to mentor another family. We can look at our family outcomes. We want our families to be learners. We want them to be advocates. We want them to be leaders. And essentially the child outcomes, which is what this is all about and what this project was developed for, was to make sure we're developing our youth. We want to we want all of these here listed are positive outcomes. We don't want to see things where we're seeing that children are delayed because there was no engagement of the family or the parents were not involved. We don't want to. We want to see where the kids are ready for school, not where they're not able to even get into. They can't even advance to the first grade because they never even went into preschool. So we have a lot of things to address. So this here can provide you with a outline of how that can happen in a trauma-informed environment. So as staff, we can work together with our families and other professionals, and especially our community partners in ways that promote the inclusiveness and the cultural linguistic responsiveness. So I'll move on to the next slide. The other outcomes that can take place are here, and I'll read that quote in the box. It's involving families in a system-level decision-making process that can build better dialogue with families, create significant buy-in for future and further engagement, and contribute to better decisions, which in turn holds agencies more accountable to those they serve. So again, this whole project was built around understanding our role and as a provider and as an agency. And here we are. How do we hold ourselves accountable? There are a number of benefits related to the family engagement and making our agency family engaged. I mean, trauma informed and having them and get family engaged as part of that. And each of these contributes to the family as a whole. So as these 5 points here show us, there's just a few of the many benefits of engaging in family. And you also will see on the next slide, we'll go over these points as well. So as you see, we've already kind of went over this. As we adopted trauma-informed care approach, we will understand there's a principle and practice that is a part of this. I know that we have learned over the years, even after studies for ACEs, which was done by Dr. Anda and Dr. Folletti back years ago, over 20 years ago, the CDC did this study. They were the leaders of that study. They released the data, which is kind of why we got exposed to understanding ACEs and the impact of trauma. That word can be used almost as if it's almost like cliche almost. And I hate to say it, I'm not saying that, I'm just saying that I think as part of us in a culture, we've been able to use this information, and I hear a lot of people say, oh, it's trauma, and we need to be more trauma informed, but not really understanding what it looks like at the end. The last part of this slide, which I think is so important, is not accomplished. Being trauma informed is not accomplished by just having a checklist. And I give you a checklist, you check these boxes, and it takes place in your agency. It's not that. It's more of you being conscious of how you're implementing a policy, how you're practicing the principles of trauma-informed care, and how that it has to be on an ongoing basis. This can be difficult for some agencies because you don't always have a person or a group of people that's completely committed to looking at how we can make a cultural change at an organizational level. But is it possible? Yes. Will it take time? Yes. So understanding that piece will be the biggest the biggest accomplishment, but also it can be one of the biggest barriers to becoming trauma informed. So if we go into the next slide, this is also part of your handout, the 4 R's of the trauma-informed care, which is the realize, recognize, respond, and also the resist or re-traumatization. And so as we look at this, if I was able to have interaction with you, I would probably say, why do we need to realize this? Why do we need to be aware? There is a huge piece in understanding that trauma is being aware is trauma awareness. I read something before where there is a universal trauma precaution, almost as if we need to assume that all people who are connected with each other are working from or coping with the effects of trauma. And that's like not something I like to say is to assume, but if we understand that people are coming from places of a struggle, you will realize that we all have our own path, and it has sometimes has shaped us, and that trauma has how we dealt with it, or how our coping mechanism, or how our community that we were surrounded with helped us deal with that is how well we come out on the other end. And that's the biggest piece about realizing. Then recognizing the signs is a huge a marker for our providers to understand the symptoms of trauma in their families that they're dealing with, as well as others involved in that system. We need to respond. We understand with the knowledge that we have with those policies and procedures that we will share later, and then also making sure that we do not create a situation where we're re-traumatizing the family or those in the community that we're dealing with. So I'll move on to, in addition to these 4 R's, there are 6 guiding principles actually to understand that process, and this is data that comes from SAMHSA, which has recognized that there is trauma in our present life, as those who we will see later on as we do survive COVID, that's a big trauma. We all have lived through that, and there's things coming out of that we're going to have to address. If our systems are not set up correctly, we will not be able to serve our clients and our communities the best way in which they need. So we need to understand these principles as best as we can. As you see in this image here, the 4 R's is the central piece: to realize, to recognize, respond, and resist. And that's in the core of it. And then around that is all those pieces are put together to help create a trauma-informed practices that we can use to engage our families. So the biggest piece is our safety, to make sure our staff and individuals that we work with feel safe, both physically, emotionally, psychologically. That's the biggest piece I would say is the foundation, so that we understand that is how we have to secure that and make sure that individuals can feel safe with us, because then that moves into our trust and transparency. Can people trust us? Most likely, if they're feeling safe, they feel like they can at least trust you to help at least share information. Okay, we understand in a lot of our communities, that I can say I come from an urban community where you don't tell your business, and you definitely don't tell it to authorities, because we don't trust, quote, them, because they are not for us. So we have to understand that you're walking into that. But if we can create an understanding that those individuals are safe, and now we're not trying to take from them or from our clients, then we can understand that you can most likely gain trust. Peer support is a huge piece. This is what I've learned as a person, as part of a community advocate, part of being a coalition member. If I can just say this, even as being a person as I'm new to parenting now in my life, peer support is huge. If you can provide that piece with your parents and those who they can identify with, the families can identify with each other, that promotes our healing through our shared experiences. That is one of the biggest things that I can advocate for now, especially as I do experience looking for peers that can relate to me and what my stage of life. Then we want to move into collaboration and mutuality, where we're truly partnering with our parents and our families. We're not battling for power. We're not looking to take. We're not looking for, and that family understands that. And then you're not taking over their decision-making process, and you're not coming in making decisions for them. You're asking and you're recognizing that this is a collaboration. You want to stay in your lane and understand that this is part of a healing process, and sharing power and decision-making is a part of that. We don't want others that we're dealing with to feel like they have no control, that feel hopeless. We want our individuals to definitely understand this is a collaborative approach. And that means conversation, that means sharing information, that means you as a provider being humble. We want to empower those individuals to make a choice. They let them know they have a voice. Again, this is recognizing their strengths. Sometimes I can tell you, sometimes with client, if you have a client and or a family, or excuse me, a community member, and I can identify this on a coalition level, that person, you may have somebody that is very, very vocal, and that sometimes can drive you crazy. But we want to make sure that we understand that they have a voice. We just have to shape them and help them understand that they are also a leader. So how can we help? How can we get that person that's most vocal to be in a leadership position to help then drive the best outcomes? And again, this should not always be, it shouldn't be the last, but it's here. But it also should be just part of everything that I just spoke about. The cultural, historic, and gender issues, that should always be a part of what we think about as when you're creating safety, when you're trying to trust, when you're creating a peer support. Understand all those cultural cultural aspects, understand the historical piece, and also understand a gender issue. If there is any of that, you do need to recognize and address that, especially those traumas that exist in all three of those areas. The next slide shows us how these 6 guiding principles can then be paired with our 4 R's in the next slide. When you pair these trauma-informed principles with the 4 R's, we are utilizing, in conjunction with our family engagement strategy, the benefits for family and children, as well as the communities and organizations that we're working with. Then we're able to utilize a trauma-informed engagement. And move on to, I don't know if the slides are advancing or not, but I just wanted to show you the next slide. Yes, that was just a piece here. If we put those things together, we can then move on to see how we can create stronger families. You have the 6 guiding principles with the 4 R's in the middle. Pair that with our, we talked about before, with the program outcomes that lead to our child outcomes. We can then equal to stronger families, which in our next slide, we discussed the family engagement and importance and the valuable outcomes and the process involved. With the trauma-informed care and the 4 R's and the 6 guiding principles, we are able to achieve stronger families. This is even more important now. If I just take a moment with this slide to say, this is even more important now because we're in a process of healing as we are part of this pandemic. If I could customize this to say, for all those who are dealing with loss related to the pandemic, we understand now why our parents have to be resilient, okay? The ability to bounce back, to spring back, to when you go through an adverse situation, how can you come back and still function and work on being healed? This is huge when you're looking at social connections, how we were not able to always have those. Now we're trying to get those back. This is how we can look at what strong families look like is here listed. But we also know it's a threat. Strong families have faced a lot of threats because of what's going on. We have to encourage our communities, our families that we're working with, to support one another, stay connected in any way, shape, or form that's safe for them. Make sure that we have connection with the children as well. This is huge with our young babies when they can't communicate with us what's going on with them. We have to be able to read that, and that is a big piece of what strong families are about, and making sure that we're here to support our families and our needs. Here at Prevention First, we have a great, I call it a magazine, but it's like a guide that talks about how to help parents teach their children to make healthy choices. How can parents, and that's the beginning, and what I love about it is that each stage it discusses how a parent can communicate with their child how to make a healthy choice, how to live a healthy life, what to look for and that could cause stressors and create barriers, how parent and the child can work through that so that, again, you don't have a struggle of power. that is a huge piece in creating a strong family. So I just wanted to make sure we moved into that. But I want to move on to our next slide. I don't want to miss this. I'm sorry, you can go back up. Okay, so our next slide, thank you. You can move it back down, I'm sorry. Our next slide, we have responding versus reacting. So we have here, which I love, I've been able to learn this through just researching about trauma-informed care. How do we respond versus react? And our traditional responses are on the left and our trauma-informed responses on the right. This is huge to me because this is something that I've learned. I've learned from my parents, and I've learned from those adults around me, or then I just went into my adulthood. When it comes to interacting with people, these are the things that I say. I give a command. I say, stop crying. I say, I'm punitive in some things that I say. The tension is waiting for you. Don't you talk to an adult like that. You're old enough to handle this on your own. All of these are traditional responses, but if we put our thinking cap on and think of the trauma-informed responses that really we need to look at and focus on as a trauma-informed care provider, we would say the opposite. On the other column, we have, instead of going to the principal's office, you can talk to the child and say, I'm here. You're not in trouble. Instead of saying, stop crying, it's okay to feel. How many times have we heard this in our community where we're always seeing a parent, we may see a parent, and we shake our heads sometimes like, why would they say that to the child? Why didn't they let the child just cry? Well, here we are, right? Because they're not trauma informed. They don't understand. So we have to model that sometimes. Instead of saying detention is waiting for you, sit with me. Don't tell them they have a voice. Let's talk together. Acting like a baby, that's a little humiliating when you say it to a child or even to an adult. You don't have to do that. You don't have to be demeaning when we're talking to our clients and our community members. This is not, it's not necessary for you to do that. So when we're trying to inform, we can understand our words count, our words matter, and we have to formulate a different response so that we have the best response when we're talking to our children and our families. Okay, we'll move on from here. This is a slide that I wanted to show you that is part of the handout. I really want to make sure that you all have this as a tool because this can give you an outline of the correct and kind of the best way, not the correct, the best way to create a plan for our families. It's inclusive, it's goal-driven, and we're able to share this and make it a shared decision-making process. We're not creating a plan and sending it to the parents or the family. We're not creating a plan without their voice. We're giving them opportunity to create a goal, an opportunity to see what that really looks like in their world. And then after that goal is set, what's next? What are the actions? What can I do there? What will you stop doing? What will you start doing? How can you continue it? That is the goal, is to make sure we're providing the best way to give our clients and our families, our community, our members the opportunity to partner. So this is almost like a planning tool. And if you get to think about this in the context of when you're doing your planning with your family, and then from a trauma-informed perspective, this can be where you're sitting down and you're putting it together. You can, again, revisit this on an ongoing basis. Now, I like to say, and my instructions are to always say with this plan, let's look at a year out. What would it look like? Sometimes we don't want to say a year. I think a year is a little too long. Can we start out with 3 months? If that's too long, start out with 1 month. We want to make sure we're doing something that's manageable and easy for our families to take part of and not a barrier. Okay, we don't want this piece of paper to be a barrier. We want this to be actually engaging. So I'll move on to the next slide. These 4 R's are listed here as, again, just questions to answer. How can we look at ourselves and then also our agency, then also our system to make sure that we're family engaged? I won't belabor this because I know I just want you to look at this to understand that there are guiding questions. I know that we're going to be coming up on our time, so I wanted to make sure you do see that. And this can be also provided as a handout as well. So I wanted to move on to our, if I had opportunity to do like a group activity, I want us to move on to the next slide to see if there's a, how to understand families. Now, this is a opportunity you see up on this left-hand side. It says realize. That's the key. That key is for us to help. This activity will help us see and realize how our families are, what our families are dealing with, and how what they're dealing with can be traumatizing, and then also how that trauma creates those barriers for them to get the service necessary. This is an online poverty simulation, so you will have an opportunity to, where it says continue to spend, this takes you through the process of learning what it's like to be something, and our clients walking in their shoes, what it's like to lose your job and only have so much money to make it through a week or a month. And then sometimes we create in our mind, I say this for me, a parent can't achieve a goal, or if a parent can't make an appointment, if the kid is late to school every day, if I'm dealing with, I'm a daycare provider and I'm dealing with absences, and why is the child not, or why is the child sick? This simulation kind of walks you through what it's like, so you can understand the challenges that they're dealing with for each person. And throughout the game, the player will make a series of decisions which impacts their income, right? Because this is all linked to poverty. It's all linked to money, and it's talking about poverty and what we're dealing with in that poverty state of mind. And it's connected to a different dilemma and problem tied to a person's health, the level of education, providing the basic needs for their family. For example, health. When I have my opportunity to select health care for my job, do I take it, or do I just deal with the penalty of not having health insurance? Because, now that's the penalty not to have health insurance because it's offered by the government. So now I have a penalty. I now have no money, no health care, but at least I don't have to have that taken out my check every week. So how do I survive? So just to understand that the struggles that the people are dealing with are every day, and those that are stuck in poverty or struggle with that could also deal with homelessness and other poor health issues as well. And then we'll move into our next slide. We're going to try to look at some barriers for family engagement and employer explicit bias. This next slide here is just giving us a quick opportunity. If we could do an activity, you will be challenged to name the colors of those on the slide. So you would just name the colors of the following words. You wouldn't read the words, rather you would say the color of the word. For example, if the word was blue, it's printed in the color red, you would say red, and you would say the colors as fast as you can. And right now I would be able to read over in the column: red, blue, green, blue, black, yellow, green, orange, green, red. But if I move on to the next slide, and this is interesting, because if I move into this next slide, the colors are different. Remember, I'm not to read the words, I'm ready to say the color. So if we can start, my arrows would come up and I would say green, red, yellow, green, blue. Okay, so I'm already out of time, right? Because I could not catch up with, my mind was, I was stopped. I had a delay, right? And this is just to show you that although the timing on both of these slides were the same, it's difficult for that second slide, for me to do that second slide. Why? Because this was based off something called a strobe effect. And it's famous because The doctor who created was a psychologist, and he's part of clinical psychology. He discovered this phenomenon back in 1930s where there's a speed of processing theory and there's a selective attention theory. And that happened because, if you push the next slide, it shows us that our strongest associations trumps what we know to be true. Okay, so the speed and the process of that information, interference occurs because those words are read faster than the colors are named. Then if you look at the selective attention theory, the interference often occurs because the naming colors requires more attention than reading the words, right? So that's when we're looking at our biases, we have to understand what we know is, if we're not looking at it without careful attention to that task or that person or that system, our strongest assumption trumps what we really know to be true. So that kind of creates that bias that we see when we're delivering services. And even though you don't want to admit to that, some of this is true. You know, we come with all of us come with this, okay? So we can't look at it as just a race issue or a gender issue. This is all related to just being human. And we move into the next slide. This is a quick reflection question. And keep going. The reflection question would be, when this strobe effect, when it comes into play with our families we serve, maybe working fast, or we wrote something or said something wrong based off on association. If anybody was able to admit that, would you admit that may have happened, such as you assumed someone was a mom instead of the grandma? You called someone, and I'm going to say myself, I may have called someone crazy instead of saying a person with mental illness. Okay? I assume the person came from a certain level of income because you look well, you dress well, you smell good. You're not living in poverty. So we don't have time for 5 minutes, but the understanding of those biases and help us understand how we deliver our service and how did this impact your relationship with the family. If this happened to you and you were called on it, how did it impact you? And then how did you repair it? So that's just a quick reflection. If we had time, we would be definitely engaging, and I would love to hear your input. But I'm going to move on to the next slide so we can end shortly. But our next here is talking about more barriers to the engagement, not just our own. We have our own biases, right? But we talked about the trauma. We talked about the biases. We're looking at how there's so many factors that can lead into barriers of family engagement. So we want to remember to keep our lens on and remember our objective of understanding how these all intersect: the trauma, the race, the bias, and in our behaviors that you see with our families. And again, remember, in a business of changing behavior, so this is how sometimes we may not see a change in behavior, and we need to reflect whether or not that's based off the trauma that families are dealing with or any biases that we have. So we move into the next slide. A refresher really quick before we end is related to our ACEs study. We have seen how this ACEs has linked to lifelong health outcomes. And on our next slide, we understand that that CDC, when they did that study with the ACEs, they were able to categorize abuse, neglect, and household dysfunction. And this is where they were able to group together what those individuals as adults were experiencing as poor health outcomes, and eliminating poverty, eliminating lack of education. They still were able to pull out these pieces here. And because of their experience, that group of people they studied, they were able to see that even as a child, being experiencing these remember, adverse childhood experiences, anything that's happened before the age of 18. So as a child, they witnessed these pieces. And because of that, it is linked to having long-lasting or causing long-lasting health issues, high risky behaviors, even mental illness, our social malfunction, disease, disability, death, and healthcare, and issues, increased healthcare costs. We move into the chronic stressors in the next slide. This is a refresher again. One of the ones we did talk about was poverty. We talked about biases, not so much racism, but again, that is a big piece of all of the things related to potential issues we may deal with and the barriers for family engagement. Our next slide here again talks about the past trauma and the impacts. Expectations that we sometimes see and our parents cannot happen because of those past traumas. The negative teacher perceptions that sometimes take place because you expect the parent to do something, they're not doing it. So you have those past traumas, you're not identifying with the family and the parent, then that child does suffer. I will go ahead and move into now the next piece, which is the current traumas that take place. Those expectations, again, the communication and the survival, fight, flight, or freeze is a big piece related to trauma. That's the model that we use, and we talk about how that interferes with communication interaction. Our slide that we will come upon, which is our last one, is talking about the worksheet again as a plan. Again, not using this as I'm using this as a facilitation of communication, not a barrier. And that again will be sent out to you as well in our email follow-up. Last slide, and then I want to thank you. We have resources here. The National Child Traumatic Stress Network is a huge resource to our community and our professionals as well, that you can check out. That's also the statewide Family Engagement Center as well. So I just want to give again a thank you to you all on the last slide for participating, and I have 1 minute for questions, and I do apologize for moving into our last hour so quickly, but I definitely want to get that information to you. Thank you all for staying on. And as my moderator, if that's it, do you see anything in the chat? I don't.
I do not see any questions yet, but people are able to raise their hand if they wanted to unmute and ask a verbal question, or you can ask a question to Alicia in the chat or question box, and I can relay it to her. But so far, just everyone was, a few people thanked you for the information. And okay. Once again, we will be sending out the recording of the training with the PowerPoint. I'll email the video and then the worksheet resources that Alicia mentioned. It'll also be posted on our website as well, prevention-first.org under our training hub. And then I'll also relay again that the certificate of attendance will be emailed within 30 days to everyone that attended, if they attended at least 50 minutes of the training. And then you will receive an evaluation. So please fill that out because we'll value your feedback. And then if you need any certification or certified health education specialist credits, you'll need to enter your CHES ID and fill out the evaluation to receive that credit. But besides that, I don't see any questions or hands raised. Okay. So thank you again, Alicia, and sounds like you covered information thoroughly. We don't have any questions.
Well, thank you. Okay, that's always a good thing. I'm open. So thank you so much for allowing me to do this and having me to present.
Yeah, thank you, Alicia. Very very impactful and needed topic. So
thank you.
So thank you, everyone. And have a great rest of your day and weekend.
Yes, have a great weekend. Enjoy the weather. Bye-bye.
Bye, everyone.